Welcome back to Health Matters. We're talking regenerative medicine. If you have some issues that you think, you mentioned people with leukemia, people who want bone marrow transplant, they can benefit from it. So if you have any question, you have comments, you can call us on the number that would show on your screen, or send a message to CTV_YomiO or Yomi_Otaibe. Okay, now let's talk. You were trying to explain, that stem cell is nothing new.
Yes, stem cell, the first stem cell transplant, which is allogenic, that is the donor and the recipient are different, was done in 1968, bone marrow transplant to, in USA. And after that, at that time we only knew little about ability of stem cells in doing multiple things. But later on, researchers were showing the possibility of using even the patient host body. That's when, in 2001, George Bush, the President Bush, signed a paper that they will not allow embryonic stem cell and so on. President Obama came. He said, okay, research will continue, but it should be patient-funded and not taxpayers' money. So since then, we've been learning more and more about what we can do with adult stem cell. It all started in those days with allogenic, taking another patient's maybe bone marrow and giving it to the cross-match recipient. But now we have the knowledge that the same patient can be given back his own bone marrow, or maybe stem cell from the fat. Fat is better anyway.
And I guess that will reduce the possibility of rejection. That
is not just even reducing. When it is autologous from the same patient, there's no rejection. That's the beauty of it.
Okay. Now tell us more about those who can benefit from this. You have benefited from it. I understand even for the skin,
Yes.
Who can benefit from this?
Okay. At the beginning, we mentioned that adult regenerative medicine is about adult stem cells and platelet-rich plasma therapy. To make it simple, when you think of something as a local problem, maybe think that platelet-rich plasma and adult stem cell can help. Joint pain, shoulder, knee, elbow, hip, to look younger, facial rejuvenation, face
to look younger.
Yes.
Okay.
People can look, 2, 5, 10 years younger. Hair loss, already mentioned that. Very great to help families, especially both male, the male sexual dysfunction, female sexual dysfunction. People can restore their marriage and life based on that. If it's also maybe needed for scar tissue, people that don't want to go for breast augmentation, they just want a simple improvement, for the cleavage area, it can, regenerate and boost that. So pretty much anything locally, platelet plasma will help. Adult stem cells using adipose tissue too will help. Bone marrow is very good for the joints. Orthopedics, we know more about that. Now, for the adult stem cells, that one take care of things that are systemic, like diabetes, kidney failure, people that are on dialysis.
What will you do, for instance, to a diabetic?
Okay, when the stem cells get into the body, they find themselves in hyperglycemic environment, that is high sugar environment. They tend to differentiate into pancreas tissue. They help to promote more cells in the pancreas that help to produce the insulin. So eventually what happens to those diabetic patients is either they significantly reduce the amount of medication they take, or they totally get off the medication.
But we understand diabetes is not, it's not curable.
Okay. Remember, I gave the definition of regenerative medicine earlier. When I said the possibility, the process of stimulating the repair mechanism in the body to start the healing process of what we thought was irreparable. Okay? So that's what regenerative medicine is all about. That's where the knowledge is. So that's why people are being placed on kidney transplant. They are getting off kidney transplant, getting off dialysis, stopping sugar. Patients are being restored from diabetic neuropathy. So people with arthritis that don't want surgery, people that are working with walker, hold people, not able to stand, walk, climb down, without even using a stick or walker anymore. People that are paralyzed are now being able to walk, stroke patients, multiple sclerosis. Neurological disorder, especially the central nervous system, has always been believed that after a couple of time, or 1.5 years, if you get the most recovery, that is it. The rest, you are going to be like that for life. With regenerative medicine, it is no longer like that. People that have been completely paralyzed from any kind of injury, either incomplete or complete spinal cord injury, after a couple of treatments, what you get is, for example...
Okay, we have a picture showing, this is the before and then after 2 years of the treatment.
Okay, yes. This was a research that was published on the U.S. Library of Medicine, the NIH, National Institutes of Health. This was published, I believe, March 2015, about a complete spinal cord injury patient whose injury was at TH2-3 for non-doctors. That means the thoracic level 2 and 3. Everything downwards was paralyzed in that patient from hemorrhagic injury. But what happened is on the 2 years later, after multiple treatments, at about 8 treatment sections, 3 months apart, in this case is that the patient started recovering all the bladder sensation, the movement in the muscles, able to stand and everything.
This is really advanced medical intervention, and in Nigeria it's not so readily available. So you have a center in Lagos?
Yes.
Okay.
All the treatments are available in Nigeria now, and there are a couple of other centers in Nigeria that are doing, maybe taking pieces of it, depending on the level of their training that they're also doing. I know some doctors who are currently in the US taking 1 year off, learning how they can use it more for infertility, stuff like that. Some people have been trained in India, who are practicing there. They don't do all this cosmetic, sexual function part, but everything that we've discussed, everything is possible now in Nigeria.
Okay, thank you so much for coming on the show today. It's really been enlightening. I'm sure a lot of people who don't know that, they can heal themselves from the body, they will know today that, is it that the cheap,
No, it's not.
Is it affordable?
Right now, because it's new, it's not for everybody.
Okay.
It's not.
So if you can afford it, then you can get it.
Yes.
Thank you so much for coming on the show, Dr. Kudai. It's been nice having you.
Thank you for having me.
And thank you also for watching at home. To join us again next week. I'm Yomi Otaigwe.